guys, what's up? A very good morning to all my viewers. And today we'll be looking at something on dose response relationship. So we'll try to analyze what kind of relationship exists between the effects of the drug onto the body and related to the dose of the drug. We'll also try to look into how we can graphically represent this kind of relationship, which we call it as a dose response curve. Now, starting with the dose response relationship, as you all know, giving you example of a simple drug, a calcium channel blocker, vasoselective calcium channel blocker, which is used as an anti-hypertensive medication, that is a drug which can bring down the blood pressure, like amlodipine. So if we give, for example, 5 milligrams of amlodipine, there has to be a reduction in the blood pressure of that individual, and there exists a relationship between this dose and the amount of reduction of blood pressure that is achieved. You will all agree that if we increase the dose from 5 milligrams to 10 milligrams, there has to be a definite decrease, more decrease in blood pressure as compared to what is achieved with the 5 milligram dose. So there exists a relationship between the dose of a drug and the effects achieved. So in general, more the dose, more is the response which is achieved. But at a certain time, maybe increasing the dose will bring about certain side effects related to the drugs, or maybe the effects of the drugs are just not achieved. We will see into all these things, but in general, a dose of a drug will be proportional to the kind of response that you get in the therapeutic doses that is usually the ones that we usually care of. So yes, there exists a relationship with the dose of a drug and the response which is achieved. Now, if I want to graphically represent this kind of a relationship, I take the help of what I call it as a dose response curve. So we can graphically represent the effects of the dose onto the body and represent it on a graphical paper, and that's what is called as a dose response curve. Now, dose response curve also becomes important to know the efficacy of a drug. Also is important to know the potency of a drug. Also is important to know the effective concentration at which most of the individuals in a population show therapeutic effects of a particular dose of a drug. So it's important to know about dose response relation curve when we talk of the dose response relationship, because the relationship is complex and is interrelated with each other. Now, as you can see from this plate here, there is a typical dose response relationship that is being seen. And what you can see onto this side of the graph is the dose of a drug. Now, visually, we try to look into the logarithm of the dose which is given, and we don't use directly the dose of what is given. We use the log scale. The reason being, if we use what we call it as the direct scale, then maybe the graph which is achieved is not a sigmoidal one, but it looks something different. We'll come to it. So we usually want this slope to be seen. That's this slope here, the slope to be seen. So that's the reason that we usually want to have a logarithmic scale of the dose that is been achieved, and that's the x-axis. Onto the y-axis, we usually plot the response. Now, the response can be efficacy of a drug as far as reduction of blood pressure is concerned. Maybe you go on to the experimental side and you want to measure just the amount of cyclic AMP measured. In fact, any kind of response that you expect with the dose, you measure it onto the y-axis. So that's the y-axis on which you measure the response. And this red line here is usually the dose response curve that we usually plot, and that is helpful for us to know so many things about the drug. Uh, so that is how it looks onto a general scale. Now, if I want to show you that if instead of using this logarithmic scale of the dose, if we try to use something of a linear scale, then maybe I need to have that paint tool. And now you can see here is a paint tool, and I'll draw a graph, for example. So that's the y-axis, which is usually the ones which is used for measuring the response. uh, Again, take the paint tool to draw the x-axis. Now this x-axis here represents what we call it as I mean the dose of a drug directly measured. It's not the logarithmic scale. And now if I want to draw the graph which is plotted for a non-log dose axis, the graph will look something of this sort. So okay, so for a drug the graph will look like this. Instead of the ones like a sigmoidal curve, it won't be that way, it would look like this. So increase in the dose, so you increase the dose here, you increase it, increase it, increase it, increase it. So if this is 1, this is 2, this is 4, this is 6, this is 8, it's 10. So again, remember these are all exponential figures because in biology we always get exponential growth. So we don't expect to get a growth which is very linear. So exponential figures usually are the ones which are used when you use a linear scale model of the dose of the dose. I'm not very good at drawing this, but anyway, so that's the dose, and that is what you get. So as you increase the dose of a drug, the concentration achieved will be the effects achieved for sorry will be much more higher. So for example, at this dose maybe we get a response which represents this, but as you go on increasing the dose, come to this level, the highest point, the effects achieved are definitely much more higher. That's just a representation. That may not be the exact way of how it looks like, but onto a linear axis of a dose, what you get is this kind of a figure. But if you want to convert this doses into logarithmic scale, then what you usually find is uh, something of this kind of a nature of the curve instead of the typical that way that we have seen. So there's a difference, but usually we use a logarithmic scale onto exponential dose curve response, and that is how we look into this. Now this curve here has, you can see that logarithmic scale here and the curve, this is the percentage response and that's the dose. What you can generally appreciate from a curve like this is that it has a top portion, the topmost part. That's what is called is the Cmax, or the not Cmax. It's called as the maximum response achieved. Sorry. Then you have the lowermost part, baseline response. Is also called as threshold. At this point, the effects of the drug start coming, and then in between that you have the slope. You have the slope, and now the slope is also important to know so many things about a drug. And midway on this slope axis is what we see, the what's called as the EC50. That's the effective concentration 50. 50% of the population start showing response to a particular dose of a drug. That is what it is. So 50% of the population under study, or to whom the drug is given, start showing the response. So that's what is called as effective concentration 50 for the drug. So this dose response curve in general, a log dose response curve, be specific on that, has a topmost component, has a lowermost bottom line, a threshold, then has a slope, and from the slope we can calculate the EC50, that is the effective concentration 50 for the drug. So here you see another graph. In fact, that's just a magnification of what we have seen earlier. So you can see that there is a threshold here. Now this is the lowermost concentration at which the drug will start showing the effect. So below this, all the concentrations and there is not going to be any effect. But at this point, the effects start coming up. So that is something which we call it as a threshold concentration for the drug. And now one more graph is to just to represent that. You can see that most of the effects of the drug, most of the effects which are achieved, like from 10% response and goes up to just 90% response, are the ones which we see along the slope of the drug. So you get to have this kind of a graph here. A limited increase in the dose as compared to this entire line. You just see this is a very small portion from this point onwards to this point onwards, a limited portion of this dose log dose response curve, but the response achieved is from 10 to 20 90%. So it's important, you just change a slight amount of dose here and the response achieved is much more higher than what is expected. So that is usually what happens with most of the drugs. A little increase in the dose and you get a tremendous increase in the response, especially when you want to look at the therapeutic levels of the drug within the body. Now, as I said, the slope here onto this graph, it can vary. It can be a steep slope, go up 70%, 90%, or it can just drop to 30, 40 degrees. So the slope can vary. The slope can vary. So the sharpness of the slope does determine what kind of drug it is. What kind of drug it is. So a sharp increase in the slope suggests, so as you can see in the figure A, a sharp increase in the slope suggests higher toxic response as the dose increases. Now you can all agree that this slope is steeper than what you have in the dose B. So if this slope is higher, even a slightest increase in the dose. If I am at this point, for example, a slightest increase in the dose and I go to this place, the response achieved is much more, and therefore the toxic effects of the drug can be seen if you try to increase the dose even by a few nanograms or milligrams. So need to be very, very careful when you look at a dose response curve like this with a steep slope. So the slope of a drug also represent the kind of effects the dose will achieve once it is given to the body, well, even into the body, as compared to the figure B here. Where is that? Okay, my arrow. With figure B, it's a kind of a flat line. So even a large increase in the dose, it is here, or you go up to this dose, you don't see the kind of magnitude of response that is seen with steep slope. So a gradual increase in the response is seen. So with this kind of a drug, you can be pretty sure that even you can increase the dose to a limited extent and may not achieve the toxic effects or may not see a huge variation in the response that is seen. So slope does tell us most of the things as far as what I will tell is about the response of a drug. So that's the reason that we want to have a slope, and that's why we plot it onto a logarithmic scale, exponential one, as against the more linear dose response curve. So some dose response curves, however, are steeper or shallower, we discussed, than the standard ones. So the standard ones are usually having the value of 1, but the slopes can vary. It can be a steeper one or it can be a shallower one. Depending upon how it is, it will determine the kind of response achieved with a minimal increase or decrease in the dose of a drug. Here you can clearly see in between line, this line here, the black line in between. I can show it with the help of arrow, with a slope 1, standard 1. Now if the slope decreases 0.5, it is more horizontal now, so the drug becomes more safer. But as you increase the slope, you take it to 1.5, they make it more steeper, and then with the slightest increase, maybe the response achieved is much more higher. So you should be careful when you see this kind of a dose response curve with a steep slope, because a slightest manipulation or a slightest increase or decrease and a tremendous change in the response may be seen with these kind of drugs. Is there any relationship between the shape of a curve and the potency? Yes, we need to ask. Now, potency is the intrinsic ability of a drug to perform. So it's that the drug is built for some effects. So whether it will show that effect or not, If you don't know something on potency, you may click my videos on efficacy and potency of a drug that will describe it in a much more detailed way. But anyway, a steep curve even at a smaller dose suggests a chemical of high potency. Okay, so as I said to you, a steep curve that we have seen, and a small dose increase, and it can bring about a tremendous increase in the response. So it's usually the high potency drugs that you see such a kind of a response with the kind of slopes which are steeper in origin. There are two types of dose response curves. One is the graded dose response curve, and the next one is the quantal dose response curve. What's the difference between this? Now we take a example of a clinical trial which is carried out in, say, for example, 1,000 individuals, and we have a drug which can bring down the blood pressure, the high blood pressure to normal. So that's the trial about. So the absolute fall in the blood pressure. So for example, after taking this drug, 5 milligrams of this drug, the decrease in the hypertension was, for example, 30 milligrams of Hg of systolic and 20 milligrams of Hg diastolic. So when you look at these absolute numbers, so after taking these drugs, the blood pressure reduced by 30 milligrams of Hg onto systolic side and 20 milligrams of Hg, that is mercury levels, on the diastolic side. So when you look at this absolute fall in the blood pressure, we deal with numbers, then we call it as graded dose response curve, But that is not what is sufficient when you want to just make generalized statements and want to show whether the drug is really effective in a population or not. So we go further, and what we try to now build up is a quantal dose response curve. So a quantal dose response curve will be something of a qualitative data where it's like whether this drug, antihypertensive drug under trial, is this drug able to bring down the blood pressure or not. Okay, so whether the person with a high blood pressure responded, whether his blood pressure has been brought down by this drug or not. So the response is usually yes or no. So out of the 1,000 individuals in whom the drug was given, 400 individuals responded to the drug treatment, so their blood pressure was brought down. We are not concerned here with the absolute numbers, 30, 20 milligrams, no. Whether the blood pressure dropped down or not, yes or no. So in that kind of a phenomena, 400 individuals responded yes to the drug. So they had some advantages after taking this drug in reduction of blood pressure as compared to the other 600 who did not show any response to the treatment with this new drug as far as high blood pressure is concerned. So you are looking more into the population dynamics when you are trying to look at the quantal dose response curve. But if you are into something which is individualistic, if you want to know exactly the amount of blood pressure which is brought down by this drug, then you are looking into something what is called as a graded dose response curve. Need to know the differences between the two, because that's where the crux of the various clinical trials lie. So we need to know whether it's a graded dose response curve or a quantal dose response curve. As I told you, graded dose response curve shows effects on a continuous scale. So it's mostly sigmoidal in nature and is proportional to the dose. So 5 milligrams of a particular drug will bring down systolic blood pressure by 30 milligrams and diastolic pressure by 20 milligrams on an average in a population. So that is what we need to know. Whereas 10 milligrams of that same drug will bring down systolic blood pressure by 50 milligrams and diastolic blood pressure by 30 milligrams in an individual. So it's kind of a continuous relationship, and there exists a relationship between the dose of a drug and the effects achieved. So need to know that it deals with absolute numbers and uh, has a relationship with that. Whereas a quantal dose response relationship describes a distribution of minimum doses of drug required to produce a defined degree of a specific response in a population. So we already discussed it out. So we are looking more into the population dynamics. So if we are looking at the quantal or the all and none dose response curve, whether the patients respond to the treatment or not, here we are not concerned specifically with how much degrees of reduction in the blood pressure is achieved or not. Now, a quantal dose response curve looks something of this sort. Is performed on population of a subject. So usually deals with whether this drug, after taking this drug, the patient is alive or dead, sleep or awake, is pain free or in pain. We are not dealing with absolute numbers. We are dealing with something which is a quality of that a particular thing. So it deals with that. So usually these dose response curve look like this. There are two, three important aspects when you look at quantal dose response curve. We'll come to that in the next slide to come. These are some of these, these, uh, what I do, these definitions. Uh, Again, these definitions, again, I have done those things in my therapeutic window and therapeutic index. So if you are new to my channel and if you feel that you don't know about it, maybe you need to gather some information, try to look into my video on therapeutic index and therapeutic window phenomena. But anyway, just to again highlight and revise on this, so there's something called as median effective dose or ED50. ED50. Again, median is a central tendency value, effective dose. Again, a dose at which the effects would be achieved. Why 50? Why 50? 50% of the individuals under study, 50% of the individuals under study will start showing the effects of a drug at a particular dose. That dose of a drug then becomes what we call it as the ED50, one terminology. The second one is median toxic dose. Median toxic dose or TD50. TD50 is toxic dose 50, or in other terms, 50% of the population under study, 50% of the individuals under study will start showing toxic toxic effects of the drug at that particular dose of a drug. So it's called as TD50. The last one is the median lethal dose. Now we usually don't use it in clinical therapeutics. We use that mostly in experimental sciences, preclinical studies, where 50% of the animals under study are dead at a particular dose of a drug. We do not translate that into clinical pharmacology because we don't want 50% of the population to die. The company who is doing the trial will be under tremendous problem, and nobody wants to die in clinical trials. So we don't use that. But anyway, there exists something called as median lethal dose. So 50% of the animals, always animals, it cannot be human beings here. Please remember. So 50% of the animals die at a particular dose of a drug. Uh, that dose is what we call it as the lethal dose 50. So we have three terminologies: median effective dose 50, median toxic dose 50, and median lethal dose 50. I go back to this figure again. So this is the dose. If this is the sigmoidal dose response curve for a particular dose, a particular drug, now that's the logarithmic dose scale. Onto the x-axis, on the y-scale is the percentage of response achieved. So at a particular 50, at a particular dose, 50% of the individuals under study will start showing the effect. So this dose here is the most effective dose. So maybe this dose eventually in the studies is found to be the appropriate dose at which most of the effects of the drugs will be achieved. As against that, we have the lethal dose 50. Now that's for animals, so it's percentage killed. So at this dose, 50% of the animals under study will die. So we don't want this to happen. In fact, our dose should be, where's my arrow? So our dose should be much less than what this is. Our dose should be somewhere here. We even don't want TD50. We don't want 50% of the population to have toxic effects of the drugs. So our dose should be lesser than what it is. So our drug should be without any side effects, just visit potency and efficacy of the drugs again. If you are new to my channel, you can just visit my lecture on potency and efficacy of the drugs, and a complete description of that has been given onto my channel and on my lecture on both these terms. Now, efficacy is usually measured in terms of height, so definitely X and Y are having a higher height, those response curve as compared to the Y. So X and Y are having higher efficacy as compared to drug Y. But if you want to compare just X and Y, both the DRCs have the same height, so the efficacy wise both the drugs are the same. As far as potency is concerned, then the thing is, the drug X is more potent as compared to the drug Y, and drug Y is more potent as compared to drug Z. So X is the most potent drug because at the smallest dose, it's showing the highest effect. So X is more potent as to Y, Y is more potent as to Z. So Z is the most potent drug, but efficacy wise, X and Y are similar in efficacy as compared to the drug dose response curve on the Y axis, on the Y scale. That's the red one in between the X and the Z with a lesser height. So that was my short analysis on dose response curve. I hope you like my session. Do continue watching my videos. Do subscribe to my channel. It's important for me to just carry on with your subscriptions. Thank you. Have a nice week.